I'm Dr. Charles from PHI Preventive Health Institute, where we share real cases and their implications with you. This discussion is about what parents should be paying attention to from a care and observation point of view. This is a situation nurses see very often at first contact. A child complains of stomach pain. Later, a headache is mentioned. It seems mild. It comes and goes. And the usual assumption is made. It is something they ate. It is fatigue. It is stress. It will pass. So care is given. The child rests. Maybe fluids are given. Sometimes simple medication is used and the symptoms reduce. But then it returns. And this is where the pattern becomes important. Because in nursing observation, repeated symptoms are never just single events. They are sequences. And sequences always tell a story. So the focus is not only on the complaint, it is on timing, behavior, and repetition. Let's break it down practically. When a child repeatedly reports belly pain and headache, the first step is not alarm, it is structured observation. When does it happen? Is it after meals? Is it before school? Is it at night? How long does it last? What improves it? Because in real care settings, patterns often show up before diagnoses do. Now step into possible contributing systems. For some children, it is linked to feeding patterns, skipping breakfast, irregular meals, high sugar snacks, low fluid intake. For others, it may be linked to minor infections that come and go, or gut sensitivity after certain foods, or even dehydration, which is often overlooked in children who are active but not drinking enough. And then there is another layer. Nurses always consider early, routine and environment, poor sleep, school pressure, emotional stress that the child may not verbalize. In children, the body often speaks before words do, and it can speak as pain. So what looks like two separate symptoms, stomach pain and headache, can actually be the same system responding in different ways. Now here's the key nursing principle. Do not only treat the episode, track the pattern. When it starts, what was eaten, activity before symptoms, sleep the night before, frequency over days and weeks, because isolated episodes fade, but patterns persist. Now pay attention to warning patterns. Nurses escalate early. Pain that is becoming more frequent. Symptoms that disturb sleep. Repeated vomiting, fever that comes with pain, loss of appetite, reduced energy, weight changes, changes in stool. These are not for long observation at home. They need proper review. Another important nursing insight is this. Improvement after simple care does not always mean resolution. So what often happens is this. The child improves. Care routines return to normal. No further follow-up is done. Then symptoms return, and the cycle continues quietly in the background. That cycle is the signal. So the goal is not just relief, it is stability. Understanding why it keeps happening, because repeated symptoms without review can delay proper identification of the cause. Now step back and look at the bigger care system. The child is not just reporting pain. The child is communicating imbalance through timing, through repetition, through pattern. And nursing care sits right at that first layer of recognition. So the key message is simple. Do not dismiss repeated complaints. Do not rely only on temporary relief. Do not ignore the pattern when it repeats. Observe carefully, document patterns, support hydration, rest, and routine, and escalate when symptoms persist or change. Because early recognition in care settings often prevents escalation into more serious conditions. Need guidance? Contact your healthcare provider for proper evaluation, or call or WhatsApp at +233 20 872 0347.